Jenny, and I'm a clinical educator with VHA's renal program, and this is our new dialysis unit in the NRGH hospital. So it's called the Renal Unit, and there are 18 stations altogether, so it spans both ends of the room, and it's lovely and bright. You can see there's lots of windows, really nice for the patients to come in for their treatment. So it's a nice bright space. And this would be considered a dialysis station. So you can see here's the machine. So this is the equipment. So this is the dialysis machine that the patients will come for their treatment. And their treatment takes about 4 hours altogether. That's from the time the machine starts to the time the machine ends. So the treatment itself is usually a little bit longer than that when you think of coming in and getting settled. And there are beds, and there are also some dialysis chairs, but most of our patients here will be in the bed. And this is a sort of a typical setup that you would find for a patient. So there's their dialysis needles. We have supplies. We wear a waterproof gown, gloves, and eye protection when we do their treatment.
Hi there. I'd like to welcome you to the home dialysis program. I'm going to take you through a tour and show you what we do in our program here. This is the new Nanaimo clinic. It's not quite up and running yet. It'll be sometime in the spring, but I work in a clinic down in the Royal Jubilee Hospital in Victoria, so I'll just take you through the process. The home dialysis program, we run two programs, peritoneal dialysis and hemodialysis. And this room is the training room for home hemodialysis. Many of our patients do home nocturnal, so that's long, slow dialysis. The training is a little more intense. It's a 6-week training program. The machines are not here. You'd have a home hemo machine, and you'd have a water filter rack, and the patient needs to learn how to change the filters in their racks, run the machine, do their needling, organize their supplies, the system. So it is a little more involved in the training for this. And this is the peritoneal dialysis training room, and this is where we'd be training patients that choose the modality for home peritoneal. We start with the CAPD, which is continuous ambulatory peritoneal dialysis. That's our manual form of dialysis. We use a twin bag system. We have a catheter that is inserted into the abdominal area. We use our peritoneal membrane as our filter. So fluid is filled in. It dwells in. We're disconnected from the tubing. The exchanges are done 4 times a day. So breakfast, they would connect, drain out the old solution from overnight, refill with the new, disconnect from that, be free to go about their activities. Each exchange takes a half an hour, but they can be ambulatory or up and moving around with a pole. We do need to teach them good aseptic technique, hand washing, connections. They have a catheter, so they have an exit site. So we have a shower here, so we need to teach them how to care for their exit site safely. So we try to mimic what they're going to be doing at home by having the shower, by getting them to do actual shower demonstration, re-demonstration, and the learning is done one-on-one, and we try to have the learning done to meet their needs, how they learn, if they're more visual, more hands-on learners, so it is a one-to-one process. This is the nursing station. There'll be many docs of areas for phones. In this area we do a lot of screening. We do daily blood work screening. We may not see our patients every month, but we have them do monthly blood work, so we're seeing them by their blood work screening. We do a lot of phone call support. Our patients are all over the island, so they do phone in. We do call them if they have any machine issues. They call in for any issues. We're here to be our backup support for them. After our patients are trained to do their own home therapy, they do come into the clinic to see our team, which is comprised of the nurse, social worker, dietitian, and they see their nephrologist once a month or every 2 to 3 months as a follow-up. And we would troubleshoot any concerns or problems, do a medication review with them to make sure we're all on the same page, that they have a good understanding of their medications and their needs for dialysis.
My name is John Billings, and this is the water room. This is at the new Regional Hospital Dialysis Board. Water is the central part of dialysis. Water is required for dialysis. If you can't supply water, you can't do dialysis, because water is a platform that is used to build the prescription that the doctor writes so that it can be transferred between the water medium and your blood as the two pass in the membrane, which is the kidney dialysis machine. What we have here is the back row, which is the pre-filtration, and the back row pre-filters and pre-treats the water so that it is acceptable to be treated by this reverse osmosis unit. The reverse osmosis unit basically does two functions. It takes all bacteria and endotoxin out of the water. It also removes about 95% of other salts and minerals that are in the water naturally occurring. So we treat the water down to what would be classified anywhere else as ultra-pure water, and then it is transported from here through a pump on this next skid, and then out to all of the dialysis bed heads, all the way around the dialysis clinic. As it comes back from the last bed head, it goes through another ultrafiltration stage on the other piece of machinery. The ultrafiltration on the other machine maintains that ultra-pure status of having zero bacteria, zero endotoxin all of the time. The other piece of the thing that is so state-of-the-art with this new equipment is the heat sanitization. Heat sanitization is done every night. We heat the water to 90 degrees Celsius and then pump it around, out and around the loop to each one of the bed heads, all the way around. It can go through each one of the dialysis machines if they select that, so that even the machine is ultra-pure clean, and then it comes back around and is disposed of down the drain. It then goes through a cooling cycle that allows it to cool, and the system is up and ready again for the next morning's runs, so that we can treat the patients and make sure that all of the water is ultra-pure all the time. Okay, after the water treatment room, these are two other pieces of machinery that we'll just go over. They are, again, the state-of-the-art in chemical distribution to the dialysis bed heads. In dialysis, you need two other chemicals other than water, and they are mixed with the water in the dialysis machine. One is bicarbonate, and the other one is acid. It's actually a potassium acid. So we'll start with the bicarbonate machine. This machine takes the dry bicarbonate, which is on the rack, and you put it in the hopper on the top of the machine. And after you put it in the hopper, it mixes with ultra-pure water from the water system we just saw. Mixes in the tank in the bottom, and then is maintained at an exact level and an exact requirement, so that you're not making too much water. So you're only making the water or the bicarbonate that you need. And then it's transported out and around to each one of the bed heads again. Back here. And this machine is also sanitized every night with 90 degree C water to maintain the integrity of the zero bacteria. The other machine we have in this room is for distribution of the acid. It's a machine that takes acid out of tanks that are stored in the next room, which is the acid storage room, and draws it into the machine, and then transports two different styles of acid that are pre-programmed for dialysis to each one of the bed heads and back. It doesn't require any kind of heat sanitization or anything, because what it requires is, being acid, it doesn't get any bacteria in it, so it doesn't require that. It just requires that it keep pumping all of the time, so we leave it running all of the time to supply acid. And what it does, these two machines do, is they really save the nurses a lot of time, because in the past they had to carry around jugs of bicarbonate and acid and transport them and stuff. The other thing that it saves, especially the bicarbonate, is that what you used to do is mix up a bicarbonate bath jug or buy one that was already mixed, and then at the end of the run, for each patient run, you'd throw that away and start with a new one. This only makes what you need, so it doesn't require any of that. You make the acid and or the bicarbonate, and you use it, and at the end of the use, you use the next batch for the next person, but you don't have to throw away anything or waste anything, so it saves a lot of money.
On behalf of the VHA Renal Program, we would like to thank our donors for funding this beautiful new unit.
Thank you!